All right. I think we'll go ahead and get some things started with our Q&A session here. So first off, I just want to say thank you to all of you for taking the time to be part of our symposium today, because all of these talks have been wonderful. I know I have walked away with lots of things to think about for the next time that I might be dealing with any of these cases myself. So we have several questions that have been submitted. So I'm just going to kind of go through these, and we can just kind of pass the microphone back and forth as our questions come up. So I think for our first one, we'll leave this one with you, Caitlin. And it is a little bit about, and you talked about this in your, I think you got to talk about this for a amount in your presentation, but for Onc Care, what are some of the kind of the features of the food that you really like, or that, where do you recommend kind of using that in kind of your expertise?
Hear me? Yes. Okay. So that's a great question. Where can we use Onc Care, and what do we like about Onc Care? So probably one of the biggest things that I really enjoy about the diet is the palatability and the texture and the taste, and really encouraging those picky animals to eat, but also having all of the extra goodies to support the patient with cancer, but also the critical care patients. So I mentioned things like the carnitine, the EPA, and the DHA are going to be really, really helpful. That high palatability, right? So if we've got an onco patient that's having issues with their GI tract, like Dr. Viduva's dog, that we want a higher digestibility and we want to try to help them out as much as we can, I think it's really great. I also think any of our picky eaters in the hospital. So, as long as they don't have a fat intolerance or some kind of renal disease, because it's also not indicated for that, it's a really, really great option to try to encourage animals to eat, and something they can go home on if they're eating it well. And then, critical care, like we mentioned in my talk, it's nice and high in protein, relatively high in fat, relatively low in carbohydrates. So it pretty much matches that needs for our critical patients. And then the last thing that I think is by far the coolest thing is that the stew can be blended into a homogeneous mixture to go down a feeding tube. I just think that's so cool.
Yeah, I agree. That little bit of like extra thoughtfulness in the way they design the food to just like take away that extra step of having to put in like a bunch of extra water and stuff to really blend it up to make your stews. So I think that's personally one of my favorite parts of that food too. Oh yeah. Yes. No, we absolutely can. So I'll hand the microphone over to you.
And I will admit that I may not be real knowledgeable on this new food, but to me it sounds like it's comparable what they promised us with the AD food, and of course AD, you're only supposed to stay on it so long. How long can you stay on this Onc Care, and how does it compare to AD?
So that is an excellent question. So kind of the gist of the question is, how does Onc Care compare to the Hills AD product, and how long can we use the Onc Care for? So the Onc Care is formulated for maintenance of adults. So if it's an adult animal, they can be on this food for as long as they would like to eat the food. I mean, obviously provided they're not gaining weight and things like that. The AD also it's a pate, and so it's a very smooth pate designed to go down something like an esophagostomy tube or a G tube, whereas the Onc Care comes in a kibble and a stew, and so that offers some additional palatability and food options. So we've got that kibble, we've got that stew on top of the pate that's coming from the AD. Does that answer your question? Okay.
Yeah, I was gonna say, I think definitely the addition of the kibble in there too, like when you mentioned for the cats that are the super picky, like dry or die, like that's all I want. Now we've got a dry option for those cats too. All right, so I think and I will say for our people that are kind of here with us in person, if you do have a question, feel free to throw your hand up. I will come over and bring you the microphone and make sure that we get your questions answered as well. Our next question is for you, Dr. Odenayo, and it had to do with the palate pexy procedure that you mentioned for the brachycephalic dogs. So is that something that you would typically consider really just kind of in emergency situations after they've been intubated, or is it something you would think about for, like, even when those patients are being anesthetized for any like surgical procedure or anything, like doing it ahead of time to help potentially reduce post-op complications?
Oh, here we go.
Yeah, I was gonna say the microphones are taking a little time to wake up, so we might just have to leave them on as we're passing them.
Yeah, that's a great question. I think my bias is obviously because I do emergency, I tend to do it when the animal comes in distressed and needs to be intubated. And I utilize that as a way to wake that patient up. But if I had a dog that was going to surgery and that dog also, other than having a foreign body or GDV, but that animal also had signs of obvious like stridor because of a long soft palate, I would absolutely consider it as a way to make recovery easier. I'm sure we've all had bulldogs who have gone to surgery for something completely different, and then they have a respiratory crisis when they be woken up.
Oh, yes.
So I think that's a great question and a great idea. So I would say yes.
Awesome. And see, our next question is for you, Dr. Nascimento. So this has to do with weight loss conversations with pet owners. And we've saw lots of, I think, good data today to talk about, some of the barriers we see with people recognizing that their pets are overweight. And I think the question is mostly, what are some of the tips and tricks you've used to kind of help overcome some of those barriers when you're looking at a pet that very clearly needs to have a weight loss conversation and the owner doesn't seem to see it the same way?
Great question. So I always try to say about the diseases that obesity can cause in pets. So I explain them. So I also use the charts from Wasava, the ones from Hills as well. I show the pictures and see here, your pet is here, so he's overweight. And also try to be very friendly and yes, giving, a lot of tips, yes.
Yeah, no, I think that's very helpful. Yeah, I like the use of the charts. And sometimes even just giving people a chance to just be like, slide them the chart, like, you tell me where you think your dog is on this chart. We're gonna do a little self-assessment here, so I can figure out like where maybe some of those gaps and stuff are. Yeah, no, thank you for that. And our next question is for you, Dr. Viduva. And it has to do with some of the data you showed on nutrition consults and practices that may or may not be doing nutritional consults as kind of part of their day-to-day practice right now. So if someone was at a practice was interested in getting more nutritional consult work done, do you have kind of any advice on best ways to kind of work that into their appointment schedules? Like, should they have specific appointment blocks, or does it work better as kind of other appointments that pets may be coming in for?
Yeah, that's a great question. So of course it's going to be clinician and practice dependent. From my experience, I would encourage it to be a separate appointment because I think that sets up the idea in the client's mind that this is like a particular service that is being offered. There will be an outcome of that appointment, which is a full nutrition plan with all the calculations, the recommendations, the follow-up, any recommended blood work, so on and so forth. So I think it creates value to the client because they are having to spend time for that particular reason. I think sometimes that information gets diluted when it's just part of kind of a general appointment. I still think it's important to mention, especially if that's the only time that you're going to have that sort of nutrition conversation with the pet owner. But for the very dedicated pet owner that wants a lot of nutrition advice, I definitely think it should be scheduled as a separate appointment.
Wonderful. Yeah. Thank you for that. And yeah, that was always kind of felt like that was my experience too. Cause everyone, like whenever it comes to the nutrition conversation, always feels like there's lots of questions. And if I'm trying to factor it into the rest of the appointment, it's like, I don't know if I have time for all these questions right now. Like, why don't we come back and set up a day to just really talk about this and kind of work through everything that, all the questions and stuff that you might have. Yeah. So yes, thank you very much. Our next question looks like it's for Dr. Odenayo, and it goes back to some of the information you shared on assessing dehydration and fluid therapy for patients. And what are some of the things that you kind of look at as a patient's getting started on fluid therapy? What are some of the reassessment tools you use to kind of assess, where they're at in their rehydration plan?
That's a great question, which I didn't really get enough time to touch on. But for a dehydrated patient, I usually recommend reevaluating them generally every 4 to 6 hours to see if your plan is working. Again, we are coming up with an estimate of how dehydrated that patient is. So it may not necessarily be very accurate, meaning you may overestimate or underestimate. So I think frequent rechecks is important. The big things I look at will be the same things you looked at to determine that that patient was dehydrated. So they having, is their skin turgor better? Is their mucous membrane moist? One of the things I did not touch on at all is weight. I think that's really helpful. So when you come up with your fluid deficit, in that example for JoJo, we determined that she had a fluid deficit of 300 mils. That will be approximately 0.3 kilograms or 300 grams that I would expect her to gain. So you can also weigh that animal frequently in the hospital to make sure they're gaining weight, but also not gaining an excessive volume of weight.
Wonderful. Thank you. All right. And looks like our next question, I believe this is for you, Dr. Nascimento. It didn't come in with a specific for one speaker. And I will say for any of these questions that we have remaining, I should have said this before. If any of you feel like if I bring it up to one person, someone else has something that they may want to add on to the discussion, please feel free to do that. You are more than welcome to do so, because I'd love to hear any input that you all have. But the question is around follow-up for appointments. And so I have a feeling that a few of you may have some different thoughts on best ways to do this. The question was around best ways to use either phone checkups or, having how often to have people come back for check-in appointments. And I'm assuming this probably is kind of in reference to like developing weight loss plans, but I think there's, we could apply this to other aspects of nutrition conversations as well.
So you do have phone calls to talk with the pet owner and explain about the nutritional plan, especially, as I said, to make sure the pet owner understood what I said. So I always we work with fourth-year students. So I ask them to call and explain again sometimes, or before coming to the appointment, to remember about the appointment, to ask what's going on. We also have some remote appointments, like we do video appointments to talk with the pet owners if they cannot come to the appointment, but they have to come in person because we need to do the physical exam, access the body condition score and the muscle condition score as well. So, but in some case they cannot come, and we do this appointment online as well, remote. Yeah.
Awesome. Yeah. Thank you for that. And then I don't know, Flavia, Caitlin, I don't know if either of you have any other thoughts you may want to add.
Well, I actually had a follow-up question for Flavia based on that. For the from the business perspective, how do you build those rechecks if they're not coming in, if it's a phone appointment or an email, and kind of leverage the support staff into your business plan?
Good question.
Yeah. No, that's wonderful. So the thing about nutrition is you're basically being paid to listen, think, talk, and calculate. And that's basically it. You're not really the one usually placing the tubes. You're not performing any other service or anything like that. So if time and thinking are your skills that you're selling to someone, then those need to be very protected. So I personally would discourage the use of phone calls, because I think it's very hard to charge for phone calls in veterinary medicine. Think about what happens with lawyers and how unhappy people are when they have to, pay those bills to talk to lawyers and whatnot. So I think trying to set it up to where they either, schedule an appointment, whether that's with you or with your staff member for maybe a reduced fee. I think that's really quite critical to successfully integrating nutrition into your practice in a way that doesn't take a whole bunch of your time without any sort of compensation for either the practice or if you're on ProSal for your paycheck. And then as far as emails go, I wish I had an answer for that. I think that's the question that's as old as time in clinical nutrition from what I'm gathering. Every nutritionist that I've spoken to seems to really struggle with how to handle the email question, because the thing is, even though I don't propose answering all their questions over the phone, because I think it's really important to see the pet and do that recheck and everything. You have to answer some questions somehow, of course, right? And email is a way to do that. So The question then becomes like how many emails and how long after the appointment and how many questions within each email, right? And every nutritionist I've talked to, I did interview like 4 or 5 practicing clinical nutritionists in the spring to try to understand that prior to a previous talk I gave. And it seems like everyone just kind of comes up with their own kind of cadence or ways that work for them. So I've heard the following. I've heard we answer emails for up to 2 weeks after the initial consultation. Anything that comes after that needs to be scheduled as a recheck. I've heard from other people that there will be a limit, like 2 emails per client, so on and so forth. So I think it can be very variable. I'm still learning how to kind of navigate that myself. I say that I have a lot of pen pals with my clients because they write me very long emails a lot of the time. But again, it depends on like what you're looking for in your practice too, because if you're trying to get people to like, know, and trust you, then I think it's very important to answer all their questions thoroughly in their emails. But figuring out how to charge for that appropriately is going to be, up to the individual practice, whether that's kind of bundled in. Maybe you charge a fee up front for your consultation that includes the time that you expect to spend on those emails, for example. So I'm going to stop talking because I feel like I can talk about this all day.
But it's a wonderful, wonderful answer. And I think really helps give some good things to think about for people that may be trying to do more nutrition consults and get more nutrition kind of worked into what they're doing day to day in their practice. All right, let's see what we've got coming up here next. So it looks like our next one is probably for Dr. O'Donaio. And it has to do with parvo puppies. So, and it's kind of a 2-part question because there's kind of a general, puppies with, acute gastroenteritis, diarrhea, but then also more specifically parvo puppies. What are some of the nutritional things you think about and some diets that you may commonly reach for?
Oh, great. And I will probably have some of my nutrition friends help me out with this. Specifically with parvo animals with acute gastroenteritis, kind of like I inferred to, I will usually get them started pretty similar with what Dr. Jetty said, especially parvo, because usually in many cases they're going to be in the hospital, usually for 5 to 7 days on average. So I'm usually very proactive about feeding tubes, and those dogs, when they come in, they get a feeding tube placed pretty much on day 1. I don't necessarily start feeding them. I usually like to make sure that they're rehydrated. If they have any electrolyte abnormalities, I make sure those are corrected before feeding, but I place it because it's convenient before they go into isolation. And, it's really rare that I place a tube that I do not end up using. We use a lot of the Royal Canin diet. So usually we would use the recovery diet pretty easily, or generally in most cases. Sometimes we will use low fat depending, because with Royal Canin too, it's been a little bit challenging keeping their products on the shelf just because of supply issues. So we go back and forth between those two. We also have Jevity, so I will use that sometimes. It certainly has the advantage of being kind of more calorically dense, so you can get away with this smaller volume. I think specifically for me, I really like to trickle feed. So instead of giving bolus feedings, giving larger amount over a shorter time frame, especially for parvo. Again, my opinion, I just feel like they tolerate it better. I'm also at an institution where we have, doctors and staff 24/7, so we can monitor those patients and have them on trickle feedings for an extended duration of time. I think certainly if you're in practice and, that animal, there's not necessarily someone that's going to be there 24/7, I think it's absolutely reasonable and probably a little bit safer if you're going to be gone overnight to bolus feed that animal, feed that set amount, and then just restart it when you get back. Did you have any other comments?
I feel like this is probably a new lane.
Okay. So I agree in the parvo puppies, that's definitely one of those instances where trickle feeding is probably going to be one of the options that's great, because depending on how well they tolerate it, right, how compromised is their GI tract, trickle feeding might be something you need to start with, and then be able to move into the bolus. And then what you're going to feed kind of depends on the dog and how old it is and what they can tolerate. The recovery can be excellent. They're not formulated for growth, but in the short term, getting some food in there is definitely a much better option. And then as they start eating, as their gut starts to heal, you can start incorporating something that's more appropriate for growth, more appropriate for whatever. If they're a younger puppy or an older puppy, I know there's not a distinction, but maybe we're more worried about it at some point than the other, depending on the dog. But definitely getting food in there, making sure we're not having any gross imbalances, but feeding a recovery type diet in the short term. I worry less about it not being the perfect diet, but being a much better option than not feeding them. I mean, we've got papers that show that feeding these animals early, they do much, much better. So
Wonderful. Awesome. Thank you for that. And I think we'll keep the microphone with you because I think we have another question that I think will be for you. So, and this is a really good question about managing muscle loss in cachexic patients. So just kind of any thoughts on kind of how to manage that muscle loss, and do we recommend higher proteins amounts, or how does it change when we're concerned about other potential complicating things like chronic kidney disease, where higher protein may not always be what we're looking for?
So that's a really, really, really complicated but excellent question, because cachexia is one of those, I don't want to call it a disease, but it's, it kind of is. It's a disease state associated with other things that are going on. And it's really hard to get ahead of it if we can get it reversed necessarily at all. We do want to support those protein levels, but more importantly, I think we want to make sure that we're getting the essential amino acids. So maybe if they can't have the super, super high protein, maybe we can get, so for renal diets, for example, are going to be formulated to have a higher level of the essential amino acids in them, because we know that they're not going to be able to tolerate as high of a protein level and a higher protein digestibility, but also trying to get ahead of things like the inflammation that's contributing to the cachexia. So can we give them some antioxidants, omega-3 fatty acids, support their energy needs, so where that high fat comes in, so we're not using the protein level. Unfortunately, in some cases, we won't be able to get ahead of it depending on what's going on and what the metabolism is like and what the disease process is like, but we can try to control it the best we can. I know that there's several supplements that are coming out. I can't remember the one. There's one that came out in the last couple of years that there's some research going on to try to help reverse this. But supporting the animal's needs, and again, is very animal and patient dependent. But I would say, again, rather than protein all by itself, the essential amino acids and things like those branched chain amino acids to support the muscle are going to be important.
Wonderful. Thank you for doing your best to tackle a very complicated question. So I think our next one's going to come back to you, Dr. Odenile, but I think there might be a couple of opinions on this question. I think it's a good one. So it's around fecal transplants in dogs. And I think this probably came up certainly in the context of parvo dogs, because there was a study that was done on fecal transplants in parvo dogs. So just kind of any updates on new research that may be coming out on kind of that method of treatment for dogs with GI disease.
That's a great question. I'm a fan of FMTs. I use them. My patient population is limited, so I would say maybe the nutritionists or some of the internists in the room with dogs with chronic enteropathy, since I don't really manage them very often. Certainly, there was that study in dogs with parvo where they did better. The diarrhea resolved faster. And certainly, I will consider it. I do not utilize it for every single dog that has parvo in my hospital. I will consider it for those dogs who are not recovering fast enough. And I know now there's a couple more options. We still do it the traditional way where we blend the poop and inject it. But I think it's like Biome is a company that has the capsules that you can get now. But I don't know if anybody else has, Dr. Jurgen, I don't know if anybody else has an opinion. Because again, I usually just use it in the acute setting and not chronically.
I was gonna say the research is really, really exciting into FMTs. And again, I think it's another one of those patient dependent things, but I feel like every year at every conference, there's several talks about it. And I think the science is really, really evolving. So it's something to look out for as we're moving forward, but definitely a very, very cool option.
Yeah, agreed. I remember in my N of 2, the patients that I got to do it with while I was still practicing, I had N of 2 success rate. So definitely some cool stuff out there. All right. Looks like our next question, kind of a clarification point for you, Dr. Getty. So for the dogs with kind of acute vomiting, diarrhea, or maybe there's been a short period of anorexia, it's like 24 or 36 hours. Where do we want to start those dogs in terms of RER when we're thinking about assisted feeding?
Oh, that's a great question. So our short term, 24, 36 hours, maybe they came in and they had acute vomiting, diarrhea. If we can get the vomiting under control, right? Now we're not going to be necessarily as worried about the volume contributing to the vomiting or the overall amount, I guess. And then the 24 to 36 hours, we're really still within that. Our metabolism is still relatively normal within that point. So I wouldn't call us necessarily a high risk patient. I'm kind of a baby, and I probably still would not start them at 100% of their RER. I'd probably be a little more cautious at like 75%. And again, remembering that we're feeding, 4 times a day, so that's going to be broken up as well. But probably metabolically appropriate to start at 75% to 100, unless you're really, really worried about that vomiting and diarrhea.
Wonderful. Thank you. All right. I think we're getting down to our last couple of questions here. So it'll be next one will be for you, Dr. Odenayo, and it's coming back to parvo dogs. Parvo's been a popular subject in our question submissions. So, and the question was just around parvo and older dogs and any differences in the way you recommend managing parvo and older dogs versus our puppies.
Great question. The bottom line is no, although one of the things I wanted to talk about, which I didn't really quite get to, is not to be fooled by parvo even in older dogs, because it does happen for different reasons. Either because that dog was vaccinated during that window of opportunity where the animal may not respond to vaccines, or the animal was never vaccinated. So I've been fooled a few times. I'm always on the parvo lookout because I don't really want it to get me again. But certainly it can happen in older dogs. The therapeutic interventions are still very similar. I think one of the things that tends to happen more, I think that's actually a good area somebody could do a retrospective study on pretty easily. But in my experience, I find that older dogs tend not to be quite as affected. Sometimes they still get really sick, but in general, they bounce back really quickly, much faster than the neonates or the young puppies in the hospital. So no, but I think the base, the foundation is still the same. So fluid therapy, antibiotics, antiemetics, nutrition will be the main things. Deworming them, because usually a lot of them, especially in the puppies, the older dogs may potentially have already been on preventative, so maybe they are less likely to have GI parasites. But I think in general, the treatment is the same.
Wonderful. Thank you so much. All right. And then I think this is going to be our last question that we've got coming through. So, and this is from both a nutritionalist and a criticalist perspective. So we're looking for multiple thoughts on this. Thoughts on pre-sedation for anesthesia fasting, because it sounds like there's been changings of opinions amongst anesthesiologists. And so they were kind of looking for your guys' opinions on fasting prior to anesthesia.
I have an opinion. I do agree. When I was at Tennessee, one of our surgeons, Dr. Tobias, she did a lot of shunt surgeries in those young dogs where, you worry about hypoglycemia if they fasted for a while. But her theory was, we know that feeding the animal causes the gut to move. So she, in her experience, based on actually offering those dogs a little bit of food, like in the morning of surgery, they're less likely to have material in their stomach as opposed to having them empty after midnight. So what we did with those dogs is they usually got a little bit of food in the morning, largely to promote, again, motility, because by feeding them, we are encouraging the gut to move. So I think that's not something we do at Florida. So I don't think that's something that's caught on with every surgeon at this point. But I know that was big at Tennessee, just just to try to encourage GI motility and peristalsis with nutrition.
I did not know Tennessee did that, and that's amazing because there is studies coming out now to say that maybe we don't need to be fasting them nearly as long. And I guess my comment is more towards the consequences of fasting them for prolonged periods of time, especially as I mentioned with those animals that are going to be undergoing repeated procedures. So let's say it's, as an example, a wound dog, right? And it's maybe having a wound vac replaced or is having a tie over replaced, and that's a dirty surgery. So anesthesia doesn't want to do that first thing in the day. It's going to be done in a dirty room, and it's going to be the last procedure of the day. Well, this animal is still going to be fasted at midnight because who knows when it might go, but it's not going to get out of surgery until 6 p.m. And so now we only have, and then they're not going to feed it for the 2 hours that it's going to be recovering. So now we have at most 4 hours that we can get all of the nutrition that this animal is supposed to get into it. And maybe it's not super GI tolerant because it's getting anesthesia and pain medications and things like that. So something just to think about in your planning is we know this animal's not going to go to surgery until 4 o'clock in the afternoon. Probably don't need to fast it for 16 hours before its surgery. So working those plans and feeding the animal when you can to make sure that we are supporting those nutritional needs. And this is kind of taking into account all of the facets of the animal's care. But just to put that little bug in your head to work with that.
All right. Awesome. Yeah. A couple of really good points, things that I had not really thought about with fasting my patients. So yes, and we'll bring the microphone over just so we can make sure our virtual attendees can also hear the question.
Along those lines, dog and cat, or just dogs, just cats? Because the reason I ask is that it seems like over the last few years, I'm seeing more and more of these cats, and we fast from 8 o'clock the night before on, and they're puking. The cats are bringing, and the owners, now sometimes the owners lie, forgive me, but they do sometimes. But some of them will say they haven't had anything, and they're bringing up pretty significant food. Do you agree with that fasting from midnight on for dogs and cats then?
I guess from my perspective, I'm thinking about I'm thinking about it in dogs, but cats are not small dogs, as we know. If we've got a repeat offender, then maybe that's something we need to look into and start fasting them longer. Or maybe they feed smaller meals throughout the day instead of one big meal before it goes to bed. In the critical care setting, I would say that the trying to feed them when you're taking care of them applies to both cats and dogs. But I don't know if we have other opinions about cats.
No, not really.
Okay.
I mean, I think it's interesting that they're still vomiting food.
Agreed.
It's been a little more the last couple of years. Just seeing more. We just had it a couple days ago, and the owner swears the cat got nothing yet. It brought up a fairly significant volume of some partially formed food.
Because, cats tend to have a much faster gastric transit time compared to dogs. Usually within an hour is what we think. So I think that's interesting. So I guess the question is, does the cat happen to have something else, an obstruction, hairball, something? Or maybe it just, even if it's because the cat was fasted, I wouldn't expect there to be large chunks of food still left in the stomach. So that's interesting.
Usually I see that with my cat who's starved bars, but
Cats are faster digesters of food than dogs are.
their GI tract is much shorter and things will move through faster in a cat than a dog.
All right.
What would they consider a safe length of fasting? If not 12 hours, but 6 hours or 5 or more or less, what would you think?
I think that's a great question. I think that's what the research is trying to look into, and probably what the anesthesiologist was trying to get at is what is the number. And I guess we don't necessarily know exactly what it is, but based on the UT evidence, it's probably more like 6 or something like that. 6 to 8. Yeah. Sorry. Also to that, the smaller volume, right, doesn't require as much time to be moved out as well. So also that kind of plays into that smaller meal thing too. So if that last meal is smaller, it's more likely to be out than a bigger meal.
All right. Good question. And we do still have a little bit of time here. So if we have any others from our audience here. Yes.
Were you the one who sat in front in vet school and asked all the questions?
No, I actually sat about in here. This is actually one that I had brought to from a couple hours ago, and I probably directed to you, but then you started kind of talking a little bit about it. So I'm not sure on the two ends here. So I'll take anybody's opinion. I see a lot, and I've been seeing this a lot for several years now, but seemingly more so in the last few years, but seeing blood in the mucus on the stools. It's very bright red. And it's not. You guys were talking, I assume. Excuse me. You were talking about bloody parvo-y look-liking diarrhea. This is not that. This is just mucus and blood in it, like a colitis type of situation. Would that be treated the same as like? Because you had me a little bit worried that maybe I need to be doing more. Usually we just kind of treat it over the next 24 to 48 hours, and usually it disappears, it's like that. But we've been seeing so much of it, and I didn't know if I should be treating that the same as what you were talking about. I don't know if you were talking about the blood and the mucus or not.
I'm sorry. And then specifically, what do you mean?
Yeah, what's my question? I'm just seeing these animals that, for the most part, they're not really bothered, other than the fact that the owners are seeing this mucus and they see blood in the stool.
Right.
They're like, oh my gosh, they're freaking out.
Right.
And that, but it's not bloody. We used to call it, when I was in school, soft or a small bowel diarrhea. And then there was large bowel diarrhea.
Right.
And that's been a little bit ago.
So what are you concerned about not doing?
I'm concerned about whether I need to be taking this blood in the mucus a little more serious, because sometimes these dogs, all they do is produce the mucus, and there's not even any really bowel movement to speak of in it, and they're not really acting bad. They're not throwing up. They're just, the owners are concerned they're seeing blood, and maybe I should take it more serious. Should I be doing more testing?
No, I think unlikely. I guess I shouldn't say no. I would say if an animal comes in, what you describe sounds like large bowel diarrhea with mucus and maybe some blood in the stool. The stool may still be a little bit formed sometimes, depending. And that indicates, just like you said, something wrong with the large intestine. It could just be inflammation or colitis. It could be evidence of intramural disease in the large bowel. So I would go based on what the dog looks like. So if it's fairly acute, it's just been going on for a few days, then completely changing the diet and just giving it time is probably going to be sufficient in most cases, because it might be stress. It could be potentially like whipworms. Things are like really easy. Those animals absolutely do not need to be hospitalized, and they don't need like a large laundry list of testing other than maybe a fecal in time. If it's been going on chronically, then that's when I would worry, is this an animal who needs to get biopsies, for instance, just to ensure that this is not something like histo or, an enteropathy. So maybe potentially trying diet. This is probably a little bit out of my place. But if it's chronic, so maybe potentially trying diet, maybe getting biopsies. So in those instances, absolutely. But if it is, again, if a dog is eating and it's just diarrhea, no, I think it's reasonable to just try. It's probably going to go away, just trying supportive care. Do you all feel differently, or do you have anything else to add? Lion and Dragon? No. Oh, yes.
So if it is something like a stress colitis, right, which we see in our dogs, if they're coming in, they don't like going there, or maybe they do sporting events or something like that, and we can see things like that. We have ID stress that has the things in it, things like ginger to help calm down that GI tract, stress bundle to help reduce the stress, highly digestible. Depending on the animal, you could also look at maybe something with a little bit more higher fiber to try to address whatever's going on in the colon. I mean, they might not have diarrhea, but maybe changing the fiber content could help what's going on. It might be something like it probably is self-limiting, but maybe we can help it be self-limiting faster. Maybe if we prep before the animal comes in and before, for a little bit after they go home, maybe trying something like a stress diet or a stress supplement.
And I want to play. Yay. Sorry.
This is Dr.
I would just
Ruggiero.
say this
She's
is
amazing.
A great, nice loop back to getting a diet history, because sometimes people feed some really strange things that can cause a lot of irritation to the lower bowel. So like bones, things like that. So finding out if they are adding anything that they should not be adding to the food that would be really irritating, because when you see that frank blood, we know it's coming out lower. And I've had a lot of bone eaters where that was really the signal that they were getting bones. Otherwise, the owners really were not forthcoming with that information.
All right. Well, I think that is all the time we have. So thank you for everyone that stuck around for our Q&A and that joined us today, whether here or virtually. If you have any other questions for our speakers, please feel free to reach out and we will be happy to get you in touch so we can get any other questions you may think of answered.